You know, behind every new medicine, every breakthrough you hear about, there's a story most of us never get to see. It's not just about one company having a eureka moment. It's actually about a huge, almost invisible collaboration that makes all of those breakthroughs possible. So today, we're going to pull back the curtain on this hidden engine of modern medicine.
But that brings up a really obvious question, right? It just seems like a total paradox. The pharmaceutical industry is one of the most competitive fields on the planet, so why on earth would these multi-billion-dollar rivals, all racing to get to the finish line first, ever stop and decide to help each other out? Well, the answer to that question gets to the very heart of how medical progress actually happens.
So here's the paradox in a nutshell. The biggest, most frustrating problems that slow down medical research. I'm talking about things like clunky, incompatible data systems or completely tangled regulatory rules. Well, these are problems that affect every single company in pretty much the same way.
And that creates this massive stalemate. Just put yourself in the shoes of a big pharma company for a second. If you spend billions of dollars to build, say, a universal data standard that everyone can use, what happens? Your biggest rivals get to use it for free. You take on all the cost, all the risk, and they get to share in the reward. So, what happens? Nothing. Nobody makes a move, and progress on that essential groundwork just stalls.
So how do you break a stalemate like that? Well, you create a kind of neutral zone, right? A space where these fierce rivals can actually agree to, well, not be rivals for a little while, so they can tackle these shared headaches together. And this is what we call the pre-competitive solution.
This pre-competitive space is all about building an invisible infrastructure for the entire field of medicine. Honestly, the best way to think about it is like the internet. No single company built the internet, but now everyone can build their business right on top of it. In medicine, this means getting everyone to agree on the boring but essential stuff, like data standards, so that companies can then get back to focusing on what they do best, competing to create the absolute best medicines.
Okay, so enough with the theory. Let's talk about a real-world powerhouse that does exactly this. I want you to meet Transcelerate Biopharma. It's a nonprofit that was founded back in 2012 for the specific purpose of creating and running this pre-competitive space for clinical trials.
And look, their mission isn't about finding the next big drug. It's about fixing the entire pipeline, the whole system. Their job is to untangle all the knots between the drug sponsors, the health authorities, and the patients, basically simplifying the whole R&D process so that everything can just flow faster.
And believe me, this isn't just a bunch of corporate mission statements. The proof is in the pudding. As of 2024, Transcelerate has actually delivered over 570 practical tools, frameworks, and resources, all designed to make clinical trials run smoother, faster, and better for everyone involved.
Okay, so they've delivered hundreds of tools, but what does that actually mean? Like, how does this stuff make a difference on the ground, for the researchers, for the hospitals, and most importantly, for patients like you and me?
It really boils down to tackling 4 major bottlenecks. First, they work to reduce insane amounts of duplicated effort. Second, they simplify trial plans or protocols. Third, they help teams monitor trials in a smarter, more efficient way. And fourth, they're pushing to improve diversity in those trials. So let's see what that looks like in the real world.
Think about it this way. Instead of a hospital filling out the same tedious paperwork for 10 different companies, they do it once. Boom, done. Or instead of every company inventing a trial design from scratch, they start with a common template. It just makes sense. And things like risk-based monitoring mean we're focusing our attention where it matters most, which is great for patient safety and data quality. Each one of these solutions just solves a universal headache that used to slow everybody down.
And look, you don't have to take my word for it. You have to hear what the companies themselves are saying. A representative from Amgen, which is one of the biggest pharmaceutical companies in the world, said, and I'm quoting here, "Transcelerate has really become part of our language at Amgen. The collaboration with Transcelerate has changed how we work as a company. It's not some side project anymore. It's woven into how they operate every single day."
But what's really exciting is that Transcelerate isn't just playing cleanup on today's problems. They're looking way, way down the road, and they have a really bold vision for where this entire field of medicine needs to go next.
And this is where the vision gets really mind-blowing. Right now, clinical research and the routine care you get from your doctor exist in 2 completely separate worlds. Transcelerate's ultimate goal is to tear down the wall between them. They want to create a future where the data from a normal doctor's visit could, potentially, also help prove that a new medicine actually works. I mean, if they can pull this off, it's not just an improvement, it's a complete revolution. This kind of convergence would fundamentally reshape how we develop and approve new medicines, making the whole process faster,
probably cheaper, and way more connected to the real-world experiences of actual patients. It is a monumental shift.
So, we've seen how this wild idea, getting fierce rivals to actually work together on the basics through organizations like Transcelerate, is literally accelerating medicine. It really just leaves you with one big question. If this model can help us find new cures for diseases, what other massive global challenges, from climate to computing, could it reshape next?